A 6-month Canada-wide shortage of children's painkillers has parents reaching out to pharmacists about alternate forms of treatment. Meanwhile, some are crowding hospital rooms to get access to the scarce medication. Health Canada issued an advisory earlier last month warning that children's ibuprofen and acetaminophen were in short supply due to unprecedented demand. Now, today, Health Canada said a foreign supply of children's acetaminophen will be available in pharmacies in the coming weeks. This while ibuprofen shipments have already arrived and are being distributed to hospitals. Meanwhile, cold and flu season this year comes with the added risk of COVID-19 variants and an uptick in respiratory syncytial virus among children. Well, joining us now to give us the latest on the situation and her advice for parents is Dr. Banerji, a pediatrics expert and associate public health and pediatrics professor at the University of Toronto. Dr. Banerji, welcome to Forum Daily.
Thank you for inviting me.
So we mentioned Health Canada is securing foreign supplies of acetaminophen, and ibuprofen shipments have already arrived in Canada. So considering these efforts, what is the current state of this national shortage?
Well, from what I see and what I hear, there's still it's very difficult to get ibuprofen and acetaminophen from on over the counter. So it's still a big issue for many parents right now as we're having a huge wave of respiratory viruses, febrile respiratory illnesses.
So what other options do parents have when it comes to children's painkillers? Are there any natural options, any online options?
Well, there are things you can use like lots of fluids, chicken soup, etc., lozenges. For as far as fever, you can take adult medications, and it's based on weight. So ibuprofen is 10 milligrams per kilogram. So a 20-kilo kid can have a 200 milligram adult ibuprofen, and you can crush it. Or a 10-kilo kid could have half a 200 milligrams. So there are ways of doing that. I would be careful with some of the medications that are not actually meant for those things. Naturopathic things or things online. I'd be very careful because you need to know what the active ingredients are.
All right, doctor. And we also mentioned that some parents are taking their kids to the ER for pain medication. What are your thoughts on that?
So right now, ERs are overwhelmed. They are in crisis. Kids are waiting for, I hear, anywhere from 12 to 24 hours. And so we should not be going to the emergency department and causing increased burden there to get prescriptions. So most of these infections, these viral infections, although they're very uncomfortable, they will go away, given a certain period of time, almost all less than 1 week. So, it's not great to see your kids suffer with a fever, but it's not life-threatening right now. And most of those kids, as long as they're feeding well, breathing okay, not lethargic, they will recover from this. So you shouldn't be going to the emergency department. Emergency departments are meant for emergencies where a child is having a real distress. And so there are alternatives, like if you can get a prescription from your family doctor, if you can take adult medications and divide it up, you can go talk to pharmacists if they're not overwhelmed to see if they can compound it. So there are other things that you can do.
All right, Dr. Banerjee, about a little over a minute left here, but let's talk about some preventative measures. How can parents protect their kids from contracting viruses in this virus-filled world?
So I think first thing is mask mandates or masks. RSV and influenza are droplets. They're spread through droplets, so masks really work. Get your children vaccinated against COVID and influenza. If you have a young child, make sure that there's no one sick coming to visit that child, and putting on masks. If it's an outsider, and making sure that if it's a young baby, to wash your hands. So those are some things you can do. If your child or anyone is sick, stay at home. You don't want to spread this, especially now. You don't want a sick child or someone else to have a sick child where they can't have access to acetaminophen or ibuprofen, and emergency departments are overwhelmed and there's no hospital bed. So right now, you don't want your kids to get sick.
Some important advice to consider. Dr. Banerjee, thank you again for joining us today on Forum Daily.
You're welcome.
Stay with us. We'll be right back after the break. And when we return, we're going to be taking a deeper look at some more news stories and headlines from across Canada and around the world. The Prime Minister is attending the G20 summit in Indonesia. The RCMP arrests a Hydro-Quebec employee on allegations of espionage for China. And a New Zealand study looks at reducing methane emissions from farm animals. We'll have these stories and more news from around the world coming up next, so stay tuned.